Welcome to the Hospital Finance Podcast, your go-to source for information and insights that can help you stay ahead of the challenges impacting healthcare finance. And now, the host of the Hospital Finance Podcast, Michael Passanante.
Hi, this is Mike Passanante, and welcome back to the Hospital Finance Podcast. Recently, the Healthcare Cost Institute released their 2017 Healthcare Cost and Utilization Report, which looked at healthcare spending, use, and prices for individuals under 65 covered by employer-sponsored insurance. To explain the findings in the report, I'm joined by John Hargraves, a senior researcher at HCCI. John oversees HCCI's research blog, Healthy Bites, and data visualizations. He is also a co-author of the annual Healthcare Cost and Utilization Report and contributes to the development of HCCI's Qualified Entity Initiative. His research focuses on the impact of policy and regulatory changes on healthcare spending and service use. John, welcome to the podcast.
Hi, Mike. Thanks for having me.
So, John, for those that may not be familiar with HCCI and the work you do, why don't you explain that for us?
Yeah, sure. So the Healthcare Cost Institute, HCCI, was created in 2011. We're a nonpartisan, nonprofit research organization focused on understanding the drivers of healthcare spending in the U.S. Most of our work focuses on the privately insured, so people who get their health insurance through their employer. And yeah, we try to get out as much good research and downloadable data as possible.
Yeah, and certainly the research we're going to talk about today is very much in depth and I think had some very interesting results. So let's talk about that. What we are talking about is the 2017 Healthcare Cost and Utilization Report. John, explain what the analysis entailed and what you were looking at.
Yeah, sure. So every year we publish our Healthcare Cost and Utilization Report, which explores the recent trends in healthcare spending, prices, and use for the employer-sponsored insured population. So the 2017 report looked at healthcare spending from 2013 to 2017. And the report's based on billions of claims for over 40 million people. And the goal of the report is really to shed some light on healthcare spending of the privately insured, because it's a sector that hasn't been as extensively studied as sort of the Medicare or Medicaid populations, because data hasn't been readily available till relatively recently.
That's a great setup. And so let's go right to the top line of the report. And you found that per person spending increased to $5,641 per person. But there's a lot of detail behind that. Can you break that down for us?
Yeah, sure, Mike. So one of the goals of the report is to describe not only the level of spending, but how we got there. So in 2017, per person spending was, as you said, $5,641 per person. And the result, that's the result of continuous growth in spending, which totaled 16.7% in 5 years. And then we kind of break down spending into four high-level categories: inpatient, outpatient, professional services, and prescription drugs. Just so people can get a better idea of, where is the sort of distribution of spending and where the growth is really coming from. And so, just to give you a sense, professional services, so that's, the physician services primarily. That's about 34% of spending in 2017. Outpatient was 28%, inpatient 20%, and prescription drug spending was 19% of total spending.
And of those categories, outpatient spending increased more than any other category. What can you tell us about that, John?
Yeah, so outpatient spending, it increased 5.1% in 1 year from 2016 to 2017. So it's relatively high growth. It's faster than the other three categories of spending we looked at. And the majority of that growth came from increased spending on emergency room and outpatient surgery visits. So ER spending grew faster than any other outpatient service, increasing 36% over 5 years. So that's a pretty rapid spending growth. Outpatient surgery the growth was 14% in spending over 5 years. But outpatient surgery is, the largest share of our outpatient spending category. So that 14% translates into a large increase in actual dollars.
And that's interesting. You can certainly, I think, justify the outpatient surgical portion of that because so much of that those types of procedures have been pushed to the outpatient setting. But I was a little bit surprised by the emergency room stat because you think these days of urgent care centers. I know they're popping up all over the place around here, and just lots of other ways for people to get care in a somewhat emergent setting without going to the emergency room. Did that surprise you?
Not really. So actually, emergency room costs and prices was an area we've looked at before in more detail than is presented in this annual report. We went all the way down to sort of the CPT level, looking at the different, the 5 levels of severity of ER visits, and we definitely saw, increases in spending and the prices for each type of an emergency room visit, and not really a huge shift in use. So a lot of that urgent care you would expect to maybe lead to a decrease in use if people are going to urgent care instead of an emergency room. But again, those would be your least severe and less costly sort of emergency room visits. But overall, we really just saw use is flat when we looked at those specific CPT codes. Now, overall visits and the procedures in emergency rooms in our annual report, we did see use kind of increase a little bit, but price was a big driver in emergency rooms.
Okay, so not an increase in use as much as an increase in price. Got it. Mm-hmm. And that is a good segue into my next question because you did look at utilization across a wide variety of healthcare services. Can you break down what you found there?
Yeah, so as you said, we kind of break spending into use and average price. And overall, looking at the highest level, we didn't really see any change in healthcare use over 5 years. It's pretty flat. And when we talk about use, we do, in the numbers we report, we've adjusted for sort of changes in service intensity mix. So, we try to think about the same services in 2013 and 2017 and account for any changes in technology or things that might have become more or less service intensive or people, utilizing more intensive services. But again, use was flat even after that adjustment. But we see variation once we look at specific service categories and subcategories. One example is inpatient admissions, which we saw a 5% decline in over the 5 years. And, within inpatient admissions, medical and surgical admissions saw declines, but admissions for mental health and substance use increased over that period. So, one thing we tried to get at in the report is that there's a lot of variation, and it's important to that overall number, is great, and it's a benchmark, and it is tied to policy and overall spending. But when we're looking at specific, services people use, it's nice to get down to those different categories and see what the drivers and what's really happening is in terms of what services people are using and how much they're paying for it.
Sure. And of course, probably everyone would expect to hear that pricing has gone up over the period that you study. But talk to us about how the prices changed over the period that you studied. Was it in certain categories or in certain areas that really sort of drove that overall price increase that you saw?
Yep, you're right there. So prices do play a big factor in the healthcare spending of this population. When spending has been increasing and use has been staying the same, it all comes down to price. And so we saw a 17.1% increase in average prices between 2013 and 2017. Particularly high price growth in outpatient settings, which was 18.9% over 5 years. Inpatient was a lower at 15.6%. Professional services had the lowest growth with 12.4%. And then prescription drug category at 25%. I will caveat our prescription drug estimates don't include rebates, but they're the negotiated prices, so it could be a little lower.
Yeah, but so prescription drugs clearly playing a big role in the overall price increase. Yeah. Maybe not a surprise there either. And one thing I was a bit surprised about was what you found around the changes in out-of-pocket costs. Talk to us about that.
Yeah, so we look at out-of-pocket costs, which includes co-payments, co-insurance, and deductibles. Does not include the premiums people pay. And, we looked at the growth in out-of-pocket spending and total spending, and out-of-pocket spending growth was slower than total. So although people were paying more out-of-pocket every year, they're actually paying a smaller share of the total spending each year because total spending was growing faster. So although it might not seem like patients are bearing less costs because they're paying more each year, it's actually a smaller piece of the pie that is coming out of the patient share. That was a little surprising.
Yeah, it is, and of course they're also paying that through premiums too, because premiums are rarely flat these days, right?
Exactly. Yeah. So, sort of shifting some of the patient burden from the co-payment, co-insurance, deductible side to the premium side could be a factor there.
Well, very interesting work here, John. If someone would like to get a copy of the report and look through all those details for themselves, where can they go?
They can go to our website, which is healthcostinstitute.org, and right on the homepage you'll see a link for annual report, as well as some of our other research, and we're always coming out with new stuff, so check it out.
John Hargraves, thanks so much for joining us today on the Hospital Finance Podcast.
Thanks for having me, Mike.
If you have a topic that you'd like us to discuss on the Hospital Finance Podcast, or if you'd like to be a guest, drop us a line at update@bessler.com.
This concludes today's episode of the Hospital Finance Podcast. For show notes and additional resources to help you protect and enhance revenue at your hospital, visit Bessler.com/podcasts. The Hospital Finance Podcast is a production of Bessler. Smart about revenue, tenacious about results.